So the next thing we're going to learn about is just a few less serious but quite common rashes that are good to just get in your head to improve your pattern recognition and help you pick apart some of these common presentations that aren't really too worrying that you might see in the paediatric emergency department. So first one we're going to talk about is urticaria. Once you've seen this a few times, it becomes very easy to recognise. Now, urticaria is caused by an immune response. It's not strictly an allergy, it's more of a response of the immune system. The most common precipitant in children is a viral infection, and that would be the most common thing that causes it. Can be other things like food, exercise, cold, pressure. There's all these different triggers for urticaria, but in children, viral infection is the most common one. Now, the rash is characterised by these raised weals, and you can see them very obviously in the picture on the left. These are all from DermNet. Now, one thing you'll notice is that in darker skin it's less obvious, and in the picture on the right you can't see the weals so easily because they just don't show up as bright red like on pale skin. So bear that in mind whenever you see a rash in someone who doesn't have white skin. But the raised weals appear and then they disappear after minutes or hours or a day or so, which makes the rash shift in its pattern over time, and that's one of the key things that can help you diagnose urticaria. Can be itchy, treated with antihistamines, usually self-limiting, and only in rare cases has it become a chronic disease. Roseola is the next one. So this is a viral illness that causes a high fever and coryza for between 3 and 5 days. As the fever resolves, which some people like to use the word defervesce for, you get this fine blanching red rash that appears, often all over the trunk and arms and sometimes face as well. And the key diagnostic feature here is that the rash appears as the fever disappears, and also the child is usually well at this stage. So the child is happy, they're playing, they're eating and drinking, they're behaving normally, they look good, they've just got this dramatic red rash, and it's not too much to worry about. You don't need to treat them with anything, and you can just reassure the patient's family and give them good safety advice and get them home. The next one is Parvovirus B19, which causes this characteristic slapped cheek appearance. So you can see these 3 kids, they've all got it, and they've got bright red cheeks as if they've just been slapped on the cheeks. Usually this is a mild illness. Very occasionally can cause an aplastic crisis because it causes the bone marrow to temporarily stop producing cells. So if a child's unwell, they need blood tests, but if they're well, they don't need anything. And again, it can be dangerous to children who have pre-existing hematological conditions, and also dangerous to fetuses who are much more vulnerable to that pause in blood cell production. So something you've got to be careful of if the child is in contact with a pregnant woman. And then the last one I want to speak about is just these non-specific viral exanthems. So sometimes just with any viral illness, you can end up with this fine macular-papular rash that is usually blanching rash, and this looks similar to some of the other specific viral exanthems, except we don't always know what the trigger is. And the only thing to remember here is just assess the child as you normally would. If the child is well and you would otherwise send them home, and they've got a blanching rash that's not bothering too much, and their observations are normal, and you think actually they're doing okay, then they probably are doing okay, and you can still send them home. And just having a rash because they've got a viral illness, not necessarily a reason for concern, as long as everything else is looking good. So that's it. And that's the last video that we're going to be doing on paediatric rashes in the emergency department. Now, there's so much more that you could learn about this. We've only just scratched the surface. A lot of people find rashes very overwhelming because there's so many different types of rashes that you might see. And because of that, I have deliberately kept this short, focused, and only picking a few of the key rashes that we might encounter. So by all means, if you want to do some more learning, go on DermNet, don't forget the bubbles, they've got a great rashes module there. Learn a bit more, but this has hopefully been a useful introduction if you're not that familiar with paediatric emergency medicine.